Good morning, guys. I hope we're all sparkly. I had two pretty intense conversations yesterday with my guys, back to back. We went deep. We went real deep. We spoke about the meaning of life, our purpose. We spoke about the TRT journey. Now, all of your stories are unique, subjectively. Objectively, they share many similarities. It's safe to say that there is not a typical patient who suffers from testosterone deficiency. Now, we all know the risk factors: getting older, being a grumpy old man, having banged in gear, done lots of recreational drugs, drunk yourself into a stupor too many times, received a few too many knocks to the heads. Got to protect this. This is incredibly important. You may not have done anything wrong. Now, I've had one guy, he's 17. He's just turned 18. He's been waiting 6 months to see me. We must show due diligence when we consider somebody for testosterone replacement therapy. And that means more than just looking at the quantitative markers that confirm low testosterone. We've spoken about the issues with reference ranges already, but when low testosterone is having a negative effect on your physiology, which is subsequently having a negative effect on your psychology, we must look deeper into this topic. Now, congratulations, you have qualified for TRT. That is not the statement that should be issued. What we should be doing is looking to causation and looking to address every single aspect that you can before considering committing to a lifelong therapy. We've said it before and we'll say it again. Lifestyle, diet, and exercise. Because if you want to feel the benefits of TRT, guess what you're going to have to address? Lifestyle, diet, and exercise. Because TRT is nothing more than normalizing your physiology. But I want to feel fucking jacked. Well, you can, but it's your decision. So I've said it before, you're designed to fight and fornicate. Your DNA wants you to be strong, and it wants you to have the capacity to procreate. So your physiology is amazing. So give it a fighting chance of working. We do not want to distort physiology. So you've ticked all the boxes. You've reduced stress. You've got good sleep hygiene. You've got a healthy, balanced diet, a plant-based diet with some oily fish and meat, and you train according to your physiology. What next? Oh, still low. Still don't feel well. I'm putting in all the effort and not seeing the reward. How disheartening is that? Might as well give up and eat Domino's and Netflix and chill. Because what on earth is the point in me continuing to bust my butt and not see the benefits? John, Dave, look, they're all doing well. Me, what's wrong with me? And then you feel all self-pity. Oh no, oh no, oh no. And you spiral down into despair. And who does that help? No one. Absolutely no one. So search for more answers. Who do you turn to? Well, lots of guys have turned to the NHS and they've been met with the, I think you're depressed, have some antidepressants. Oh, you can't get it up, have some Viagra. Well, it's not that I can't get it up, actually it's my libido is low. You can't get it up, can you? Have some Viagra. So you kind of face a brick wall. Now, if you have a bit of insight and understanding, and you've researched this topic of testosterone deficiency, you may well have presented to your GP with the BSSM guidelines. They are designed to help clinicians make the diagnosis and hopefully treat you if you need it. Now, you need 2 confirmed low readings. They need to be at least 4 weeks apart to make sure the first one was not erroneous. They need to be early morning samples, because what you are really doing is testing to see how effective the HPG axis is in producing testosterone. Hence, anabolic processes predominate overnight. Ergo, take the test in the morning. Now, this does not really take into consideration SHBG and subsequent free testosterone. And we all know that free testosterone is more important than total testosterone. However, all 3, total, free, and SHBG, are important, and estrogen and thyroid and all of these other parameters that are necessary to make an effective diagnosis of testosterone deficiency. But we'll go with the BSSM. Less than 12. If you're symptomatic, you could be considered for TRT with a second confirmatory test, but you must look to the reversible factors discussed before. Also, thyroid plays a role. All hormones are dependent, they are not independent. Whether that relationship be direct or indirect, we are striving for balance within the body. This wonderful process of homeostasis, it's complex. We are trying to maintain a stable internal environment despite external changes and internal changes that happen as a result of catabolism. So in the day you're predominantly catabolic, and the nighttime you're anabolic. But we are still trying to maintain homeostasis, despite there being contrasting processes, which aren't really contrasting processes because they actually work together. We said it before: early morning, high testosterone, high cortisol. Go hunt, go gather, go exercise. Use your body appropriately. Physical, not psychological. Don't think, do. Can you remember those days when you were younger? You just got on with it, didn't you? You didn't sit there and worry about life. You just got on with it. We made some bad choices. Anyway, whatever. It was good fun. But lessons learned. But those lessons learned are often far too late. What would you tell your younger self? Tell myself a lot of things. But listen, if I hadn't done what I'd done, I would not be sat here talking to you, trying to effect a positive change to you, the individual. So you need to have a comprehensive blood workup. 2, venous, not capillary. Capillary is a waste of time. I've seen way too many erroneous results to take any capillary blood sample seriously. Do not do capillary sampling. It is a waste of time. And we do not accept capillary samples at the Men's Health Clinic. Gold standard, baby. Oh, but it's convenient. Oh, shut up. If you need testosterone replacement therapy, do not take shortcuts. This is a lifelong therapy you are committing to. Do not take shortcuts. So, a comprehensive blood workup. The TRT Complete and the TRT Complete Plus are our diagnostic tests. The TRT Complete is complete, but the Complete Plus adds in vitamin D, obviously necessary for testosterone production, zinc, necessary for testosterone production, folate and B12. Whilst they're not directly concerned with testosterone, they're two super important micronutrients that we believe should be measured as a matter of routine and are commonly abnormal, and they can commonly present with similar low symptoms or negative symptoms. Because the funny thing is, the symptoms of low testosterone are all pretty vague, aren't they? Just not for yourself. But it's the dysregulation in your physiology that affects numerous organs, because remember, testosterone, estrogen and DHT affect numerous organs. Then you have numerous potential negative effects. So get a comprehensive blood workup, then speak to a clinician who knows their arse from their elbow, who is not trying to sell you TRT. I turn away a lot of patients. If I've accepted you for a reason. But I turn away a lot of patients. I say testosterone is not in your best interests. Don't hesitate to contact us again in the future, but I don't think it's right for you. I don't need your business. I will always act in your best interests. So, congratulations, you qualify for TRT. If there's something that I can identify that you need to do, then I'm going to tell you what you need to do. I won't close the door, but I'm going to tell you what you need to do. Because the clinician should always be acting in the patient's best interest, not worried about this. Now, there are certain groups on the internet that are happy to give out medical advice with absolutely zero medical experience and the inability to conceptualize and give people appropriate advice because they don't know them. Some random writing a paragraph on the internet. Oh, I think you should do this. You fucking what? There's a group on the internet that con a UK doctor out of enough testosterone to blast a couple of cycles. They're essentially blasting and cruising. If I knew who you were, I'd tell that doctor. Because you are doing harm to a medical condition where patients have admitted to me that they are suicidal. Some of my guys just want to get their leg over. And one of my guys I'm just thinking about right now, who said that, had low testosterone, he's in his 50s. He's actually had a massive transformation from being a bit of a chunky monkey to being a lean, mean fighting machine and feeling as if he can take on the world. And he is taking on the world. So it's extremes, but there are similarities in every single journey. We should be working together, not against each other. That is the problem with society. So before considering TRT, show due diligence, do your research. Don't listen to morons on the internet. Do proper research.